Hello, everyone. Dr. Virginia Elis over here. I am going to be answering questions about dental implants. We've had questions coming in for dental implants. So today I'm going to be answering the most common questions that come in. So I got my cheat sheet here as usual. There's so much information. I am going to answer the following. Dr. Elis, what are dental implants? So in a nutshell, a dental implant is basically a titanium screw or sometimes a ceramic screw that is placed into the bone socket of a missing tooth section, just like this. And what it does is it replaces the missing root, okay, that you had on that tooth. So that's what basically it is, okay? See right there, that's what it looks like. What conditions could cause a dentist to recommend dental implants? Well, basically, if someone has teeth, and they lose a tooth or multiple teeth due to gum disease, an accident, or if you were born without some teeth. Yes, some people are born with missing lateral anterior teeth or some premolars or baby molars that never came in. That could be, that don't give rise to adult molars. That could be a condition. What are the advantages of dental implants? Well, the advantages are that it's very much like a real tooth, but full disclosure here, nothing that we put in the medical field or dentistry that is artificial is never as good as your real stuff, okay? So a real tooth is not better than an implant, okay? Providing that the real tooth is healthy. A real knee will be better than an implant. I don't know if I just messed up on what I just said. A real tooth will be better than a dental implant, providing that the real tooth is good. Just like your knee. No one can tell you, oh, my fake knee is better than my real knee, providing that knee or fake hip was normal, okay? Nothing will ever be as artificial, as good as what you had before. It can come close, but it's better than having dentures. Sometimes it's better than having a bridge. So that would be the answer to that. What are the advantages of dental implants? Yeah, basically, you have something fixed. It can be quite real and very close to what you naturally had before. It's not the exact same thing, so just remember that, okay? Just because it's an implant and it looks a lot like a real tooth, it's never exactly that, but it's pretty close to it, okay? What is involved in the dental exam of an implant? Basically, when you come in, if we're recommending you're missing a tooth and we're saying, hey, you know what, why don't you consider a dental implant? You will go in, I'll usually send you to the specialist, and the specialist or the surgeon will go ahead and place it to screw the dental implant. But what they do in the consultation appointment is they do a three-dimensional x-ray. They assess, how the bone shape level, what nerves are around the tooth over here. They assess whether or not your situation and your medical history is conducive or positive and increases the chances of you having a successful case of implant integration and placement without complications, okay? Or the least likely amount of having complications. Why is my medical history important? Very important to find out your medical history, because people would say taking medicines like bone-building medicines, if you've been taking those for a while, especially if it's IV, like you take the infusions for, bone-building medicines for people with osteoporosis, usually you can't do that. Extracting a tooth or putting in an implant puts someone at a risk of having a jaw die off. The bone just doesn't heal and starts to die off. If you're on blood thinners, that can be a problem. If you're going through cancer treatment, or if you have, say, a transplant, organ transplant, and your immune system has been weakened, that could put you at risk for an infection. So while it does not necessarily take you out of having an implant, chances are you may not be in the best medical ideal situation to be able to have a successful integration of an implant. However, every case is different. So just remember, every case is different. You won't really know until you come in and we do a full assessive exam, a comprehensive exam to figure out what your situation is, okay? How will my dentist come up with a treatment plan that is right for me? Again, the way we do it is the three-dimensional x-ray, the CT scan, full medical working history, and we check around your mouth to see how your bite is, whether you have the right bite for an implant, what your hygiene is like, what the gum condition is like, your medical history, and your bone and shape, your bone socket level and the shape of it, and what nerves are around those areas, okay? Because you do want to minimize the chances of injuring nerves around those implants when we're placing them, okay? What are the steps in the process of placing a dental implant? So basically what happens is if you have a tooth that you cracked or broke or a tooth that was infected, the first thing that is done is we remove the tooth. Sometimes you have to put a bone graft, which is a scaffolding mineral material to allow bone to grow in there to fill in the hole better, get some more thickness, okay? So that you have a higher chance of having an implant here that will integrate or fuse to the best of the ability, okay? Okay, and then once that happens, so if you do have the tooth taken out and you have a bone graft to build bone in there, to build more bone, it will take 3 months for that bone graft to take in. If it does take, because sometimes it doesn't, okay? Most of the time it takes and you build more bone, things are great. If it does take after 3 months, then the surgeon will place the implant, okay? They'll place the implant here. They'll put what's called a healing cover, which is called a healing cap right here. You're going to go home, wait 3 months, come back. When the surgeon assesses that it has successfully fused or integrated, then what's going to happen is you will come to me. I will go ahead. So basically, this is an abutment, and the abutment takes a place of this area here, the tooth structure. I will take a mold, send this to a lab, okay? So the lab will take 3 weeks to make your implant crown. So at that point, I put the healing cap or your temporary crown back in. You go home. 3 weeks, 3.5 weeks later, you come back, and then what I will do is I will go ahead and take this healing cover off or your temporary crown, whatever your situation is, and I will go ahead, I'm going to put these back in here, and cement or screw in your implant, which is right here, and it pretty much looks like this, like a natural tooth, and you go home and you just care for it like you would a natural tooth. Pretty similar to that. When would bone grafting be required? A lot of times, that's a great question. Doctor, when is a bone graft required? A lot of times it's required. It'll be determined before and during the procedure. A lot of times you don't know what's really going on until you open up a tooth or you open up the surgical area. Teeth are like a box of chocolates, Forrest Gump. You never know what you're going to get until you open it up, okay? When choosing new artificial teeth, what options will I have and what are the pros and cons of each? So basically, if you're missing a tooth, what are the options that you had? You can have it, let's say we had to pull a tooth in here. One option is do nothing, which I never recommend because teeth shift, okay? So you could go with a removable, something that comes on and off, or a fixed option. So an implant would be considered a fixed option, okay? A removable is like a denture, you take on and off. Those are not usually for younger folks. Those are usually ideal, okay, because they're kind of uncomfortable. But if you have like a medical condition where you just can't have a fixed option for a crown, then just go with your removable. Again, you will have all those options discussed at your consultation appointment so that you can make the best and fully informed decision that will work out best for you, okay? There we go. So sometimes you could do a bridge, okay? This is a fix where you shave the crown here, you shave the other tooth in here, and you put this in here, okay? So pros and cons to this is that if you have teeth that already have crowns, you can take off the crown and put a new crown in there and then join without having to do an implant. That would be an option. And doing one bridge, like a 1, 2, 3 unit, 3-tooth bridge, would be close to having one implant crown, the cost of one implant crown, okay? So hopefully that'll answer your question. How long does it typically take to recover from dental implants? Usually it's a pretty quick thing. It is a 3 to 6 months and 3 weeks process, either 3 weeks, 3 months if you don't need a bone graft, but if you do end up needing a bone graft, it'll be 6 months and about 3 weeks, okay? 3 for the bone graft to take effect, and 3 for the implant placement to fuse, and then another 3 or 3.5 weeks for the lab to make your implant crown, okay? Can dental implants get cavities? The actual dental implant or the crown, no, because it's made out of metal. Bacteria don't chew through metal, okay? But what can happen is if you don't maintain your implant or you don't come to the dentist and you neglect yourself, you don't clean, sometimes you could get bacteria in here coming in, and it can the implant can become detached or it can grow a pus. It's called a failed implant. So in that sense, you could get an infection, not necessarily a cavity, okay? It's an infection. What are the costs and financing options involved with dental implants? Okay, the costs right now, we are in 2024, about to start June. It's about $8,000 for an implant, okay? So it is quite a bit. Options is you could pay out of pocket. You could use HSA accounts, flex spending accounts, third-party financing options, and you can come and ask us. Every office is different, so each office has its own set of resources available for you. I would just say come in, find out what your situation is. First, see if you actually can have an implant, and then we can figure out the financing part for you, okay? Just give us office a call, case by case. So that's the way to approach it. The most insurance plans cover the cost of dental implants. A lot of them don't, and a lot of them do, but don't expect dental insurance to cover your entire implant. A lot of them don't. They'll have clauses saying, well, if you started our insurance company, and you had a missing tooth to begin with, we're not going to cover it. So not everyone does it, and if they do, most dental insurances cover anywhere between $1,200 to $2,500 per year, and they have all kinds of requirements. So that is something that you would find out when you come in and talk to our office coordinator or office manager, who will verify your insurance benefits. Or if you can't come to this practice, just talk to the people who handle the insurances in your office. But again, don't expect the insurance company to pay for the entire thing. Expect them to pay only for a portion of it, if they even cover that, okay? How can I schedule an appointment to talk to a dentist about dental implants? It's very easy. Just call my office, okay? 925-254-4043 or orindadentist.com, okay? orindadentist.com is my website. Or if you're not coming to my office, you're, too far away, call your dental office and tell them what you want and that you'd like to come in to check out the options for dental implants. That's the way to do it. Okay, it is my hope to have answered most of the questions that, you had in your mind and in your heart. So if you still have any questions, give us a call at 925-254-4043. Come in for a consultation if you need. If you found this information useful, press that like button and subscribe to our channel. If you know a friend or a dearly loved person that you care about that has questions and you're trying to find out information for them, send them a copy of this video. They'd appreciate it. I'd appreciate it. And we're looking forward to meeting you. All right, we'll see you at your next video. Take care and have a great day. Bye.